Thank you for asking me to speak here in Singapore. It's a pleasure to be here. So integrative health, what is it? Well, integrative health or integrative medicine is not only the merging of Eastern and Western philosophies and healing systems, but of course it's using Western medications, drugs, pharmaceuticals, as well as natural remedies, diet, supplements, herbs, and homeopathy. The idea is to use whatever the patient needs. The idea is it's not a cookie cutter operation and that you have a disease, everyone gets the same treatment. Everyone needs an individualized, personalized treatment. Everyone's different. They've got a different medical history, they've got a different physiology, they've got a different emotional state, they've got a different social circumstance, and they have different preferences and tolerances. So integrative medicine speaks to this and also puts much more importance on the doctor-patient relationship. We are also integrating mind and body. So as you all know, I'm sure in this audience, every thought we think has a direct reaction in our body. Now the obvious example is when you watch a movie, I don't know about you, but I get very, very stressed. Sometimes my pulse is about 110 a minute if it's one of those thrillers or frightening movies. And so the stressful thought increases our pulse rate, increases our blood pressure, increases our respiratory rate. So in integrative health, we're paying attention to the integration of the mind and the emotions and the body and the physiology, the herbs, the diet, as well as drugs, and Eastern Western philosophies. So let's talk about patients. Give you some examples of what I do day to day in my integrative health practice. Now, Stephanie is a typical Hong Kong patient, 34-year-old banker. She's doing very well at work, works very hard. I've made the diagnosis of irritable bowel syndrome. And this is, of course, primarily, our job as doctors is to exclude anything different, such as a bowel cancer, an infection, okay? And that is our responsibility. And it's also the responsibility of the complementary practitioner not to miss those conditions and not to treat them perhaps inappropriately, but to refer them. So we have to work together in this way. So irritable bowel is a condition of dysfunctional intestines. Instead of working nice and smoothly day in, day out, moving waste products out of the body, the muscles in the intestinal tract go into spasm and they cause pain, diarrhea, urgency, or they relax and do nothing and there's bloating and constipation. So it's very common, up to 20% of the population have it. It's made worse by stress, tends to be familial. We know all these things about this condition that's so common. And this is a typical condition where integrative medicine will really help. So what can we do about this? Well, the obvious thing is to talk about dietary stimulants, caffeine, maybe spicy food, and give the patient advice about this. And then the naturopath might go further and talk about food intolerances. Now, food intolerances occur in up to 40% of the population, and often 2 days after you've taken the food, which is kind of difficult. It's not obvious like a peanut allergy that will happen instantly and perhaps cause death. Food intolerances take longer to react. They're a different thing, and they have more vague symptoms such as bloating, tiredness, or even lack of energy. But this, of course, might be a slice of the pie in the irritable bowel syndrome because it's one of those conditions that it can be caused by a lot of different factors. It could be celiac disease, which is wheat allergy, of course, that's the best known, that causes severe tiredness, weakness, malabsorption in the gut, and the naturopath knows about this. Or a doctor who does naturopathy would give the same advice. So your intestines suddenly are not absorbing all the nutrients in your diet, but they might be absorbing a lot of rubbish. We call that leaky gut syndrome or gut dysbiosis. So we can go further. In Stephanie's case, she said we did give her herbs, herbal capsules that really helped, 90% better. She took them with meals and she was delighted. But she came back to me last month and said, it's been great, except I've been really stressed the last week and it's sort of come back again. So this is very disappointing. And we go on to the next layer of therapy, which is the stress management. And we can do this by recommending regular exercise. And for her, what really worked was aromatherapy massage. Now, I don't know exactly why that worked, but it was a good choice for her because it involved relaxing her tense muscles through the massage. It involved taking an hour out every week to just nurture herself. It's a very nurturing therapy. And remember, she works in a high-stress environment that is not nurturing as a banker. And of course, the essential oils themselves have a lot of potencies and a lot of valuable effects. So we had her on herbal capsules, we had her doing aromatherapy massage, exercise regime, traditional stress management. And there are medications prescribed for this condition, but they tend to be Valium-type drugs, which of course work very effectively, but are highly addictive. I mean, they only work because they're artificially relaxing the patient. So this is always an option for people. It's not that it's not an option, but it's not a particularly satisfactory one. So we discuss the merit of herbs, the merit of drugs. She's a particularly interesting case I'm going to share with you because this is very unusual. She has had, I said to her, well, how long have you had this condition? Oh, all my life, always had it. Just been worse the last year. So I kept asking her, when did it start? What age were you? Well, it did start when I was 8 years old. Right, interesting. Okay, so anything traumatic happened at that age? A lot of thought. Finally, we remember. Well, I do remember I was playing in my grandmother's house. I really love my grandmother. And she died in her chair. So the child had gone up, had been playing for hours, not realizing the grandmother had died, and then got such a fright when, she touched grandmother fell over dead. So actually probably thought that she'd killed her grandmother. And she said after that, she locked herself in a dark cupboard for 12 hours. No one could find her. Parents couldn't find her. She was terrified. And then, as in many cases, this seemed to get internalized in her body, in particular the gut. And that's when her irritable bowel syndrome started. So by some questioning, we get to, this seems to be the root of this problem. And then a therapist, a counselor, a psychologist can take it from there. So this is how we work with our colleagues. There's lots that can be done, lots of different areas. And this is a common problem. And you see the amount of things and we can put on the table to offer. Because one of the things about integrative health is, surely if we take the best of all these forms of medicine, and I believe modern medicine is wonderful, but we add on layers or complementary therapy, surely we can come up with something even better than any one of those to help our patients. So this is about giving our patients 100% so they can be 100% healthy rather than 90%.